Hi everyone. So we've already discussed about the PAP test, which is a test for the screening of cancer of the cervix in one of our earlier discussions. And today I'm going to elaborate a little more about the PAP test. Once again, I am Dr. Neha Gupta and I bring you greetings from Feminine. So, what can you expect from a PAP test? What does an abnormal test mean to you? So, the abnormal test result would mean that the result could show the presence of infective changes, which means there could be the presence of inflammation, or it could show the presence of more severe abnormalities. That means the cells are of an abnormal nature such that they can go on to become cancerous. So these are the precancerous changes. Now these changes can be mild, so they can be reported as low grade lesions, or the changes can be moderate or severe in nature and they can be reported as the high grade lesions. In any case, it is important to go back to your gynecologist and discuss your test results. Now, can the PAP test be done during menses? Well, the answer is a clear no. If you're having bleeding, then we do not do a PAP test. We wait for the periods to get over and then only we do the test. Now, how to manage the discomfort during the PAP test? So, there's no significant discomfort during the test. I have explained about the procedure of the PAP test in detail in one of the earlier videos. And so, as I had told you, the PAP test is basically an OPD procedure. It is just like getting a gynecological examination done. And so, most of the times, there is no significant discomfort and there's no requirement of taking any painkiller to manage that discomfort. But of course, it is very, very important to know what the test would involve, what would be the steps of the PAP test, because once you have a prior knowledge about something, then it is always easier to have a mind makeup. You know that you're going ahead with the test, and so you are more cooperative during the test, you are more comfortable during the test, and so is the gynecologist who is taking the sample. You should always pass urine before you go for the test so that you are comfortable, and feel relaxed about getting the test done. Know that the test is very important to be done. Discuss it with your gynecologist. If you have any apprehensions in your mind, talk to the gynecologist before you undergo the test. Once you have sufficient knowledge about the test, it will be much easier for you to undergo the test. Any which ways, the test is just a 5-minute OPD procedure and there is no significant discomfort during the test. If, however, while the test is being done, you feel a lot of discomfort which makes you, contract the muscles of your thighs, or it becomes very difficult for the gynecologist to see the cervix and take the sample, then also nothing to worry. We can just give a rest at that point of time, and maybe you can go again sometime later and then again try and get the test done. So it's a simple test, not significantly associated with any discomfort or any pain, and all women and girls are easily able to undergo the test, so do not worry at all. Are there any risks associated with the PAP test? Well, there are no risks associated with the test. It's a simple test, very, very, very commonly performed, and there are no risks of undergoing this test. Then the next question is that is bleeding very common after the test? So yes, bleeding can happen after the test. If there is, there is a small raw area on the cervix, then once we move our device over the cervix to collect the sample, that raw area can bleed a little. So many a times after the test, there can be some spotting or there can be mild bleeding, but please do not worry about it. We do not in fact need to give any medications even to control the bleeding. It will just stop on its own in a few hours, and it is not a heavy bleed. It is just a few spots of blood or very minimal bleeding.